Good afternoon, everyone. My name is Laura Jacobs, and I am the Education and Outreach Coordinator for the Brain Injury Alliance of New Jersey. We are so happy to bring this dizziness and brain injury webinar to you today. Before we begin, I just wanted to let you know about two other events coming up in the near future. The first is our virtual annual seminar for professionals on May 11th, which provides a wide variety of topics relating to brain injury and also providing CEUs. The second is our virtual Family Fest, geared toward individuals that have sustained a brain injury, their caregivers, and for those that work in the field. And this will be on June 15th at 10 a.m. Fun and resources will be provided, such as art, mindfulness, information on COVID, and on transportation throughout the state of New Jersey. For more information, the links will be placed in the chat section of the webinar today. Today, we are so proud to welcome Dr. Nidhi Shah. Sorry, Dr. Shah. Dr. Shah will be presenting on dizziness after brain injury, why it happens, and what to do about it. She will be talking about the different types, the causes, when to seek help, who can help, and the different types of treatment. So, with no further ado, I'd like to present Dr. Shah.
Hello, everyone. Thank you for having me, Laura. Thank you so much. I'm going to go ahead and share my screen, and we'll get started as soon as possible. All right. So today, as Laura told us, today we're going to talk about dizziness after brain injury, why it happens and what we can do about it. This is a quick disclaimer. Please go ahead and give it a view.
Oh, and Dr. Shah, I'm sorry. I had meant to mention that I also have a poll for everyone if they'd like to take it now so you can see who's in the audience. I'm sorry for interrupting you.
No problem.
So if everybody would just like to look at their screens, we're going to have a poll right now. And the poll is, who is included in the audience today? So let me see. And I'd like you to write if you are a professional, an individual who has sustained a brain injury, a caregiver, or other. And this way we'll have an idea who's in the audience as Dr. Shah provides this amazing information to you today. So we'll give it a few more seconds. We just have a few other people. And as you can see, Dr. Shah, we have at least half of the audience is professionals. We do have about a quarter individuals that have sustained a brain injury, a few caregivers, and then other.
Wonderful. Great to know. Thank you so much for the poll. I appreciate it. I'm going to go ahead and continue then, Laura. Okay, so here's some food for thought. Why are we discussing this topic today? Because 65 to 80% of individuals who have a brain injury suffer from dizziness at some point in their disease process or recovery. I'm going to talk to you a little bit about me. I'm a doctor of physical therapy. I was certified in vestibular rehabilitation by the American Institute of Balance. I've been a physical therapist for over 11 years. I served hundreds of clients at various hospitals. I've initiated hospital protocols for people with brain injury, stroke, and vestibular conditions, Parkinson's. And now I have my own company called Your Movement Specialist, who provide one-on-one individual physical therapy with a doctor of physical therapy within your home. And a little bit more personal, I'm a mother to 2 girls, and they keep me on my feet. They're 1 and 5, so I stay busy between work and the 2 children. So if you want to know a little bit more about Your Movement Specialist, my company, you could find out about us on our website. We have a Facebook page, an Instagram page. You can also email me if you have any specific questions, any specific needs, please. This is my email address, and I think this PowerPoint is going to go up on the BIANJ website, so you could take a look later if you'd like, or you could note it down right now. And here's my LinkedIn profile for whoever's interested in knowing a little bit more about my background. So the objectives of this webinar are what are the body systems that help us stay balanced? We're going to learn about the different types of dizziness, the different causes of dizziness, when we need to seek help, when we need to go around, not deal with daily things and go and get help. Who are the individuals, who are the professionals who help treat dizziness, and how it's treated. We're going to talk a little bit about each of these points, and we have a lot of time at the end for questions and answers as well. So there are several body systems that help us stay balanced. It's almost like a circuit. There's an input, there are sensory systems that take the input, it's processed somewhere, and then the output helps us stay balanced. So the three sensory systems, I'm going to elaborate a little bit in the incoming slides. The input integration, or the processing of that information, happens in the cerebellum, which is a little brain located right below the big brain we have, the brain itself, and the brainstem, or the part between the brain and the spinal cord. All these three organs are responsible for processing all the information that our body gives us, or the sensory systems give it. And then they use motor output, or muscles or joints and things like that, to provide adjustments to the posture, use reflexes, use strategies to make us feel balanced and steady and prevent us from falling. So the first sensory system is the vision system, the visual system, to be able to see where we are. When we turn our head, the field of vision moves to the right or the left, depending on how we move the head. So the vision system is the first and the strongest feedback system that tells our brain where our body is in space. The second system is a little more complicated, and not everyone knows about it. It's located within the inner ear. So if you look at this picture, it's that purple thing with the three little hoops on top. They're called the semicircular canals, and there's a little structure underneath it called the utricle and the vestibular nerve. So these things make up the vestibular system. It's really tiny. It can fit on the tip of my finger. There's two of them, one on the left, one on the right. Think of these systems as the systems that tell your brain where your head is in space. And if you're moving your head to the left or the right, or when you sit in a car and you start to move and you feel like everything else is moving, that's your vestibular system telling you what's going on in your surroundings. The body awareness, or somatosensory system, is the system that is basically the pressure, the touch, the joint position sense that our legs and feet and other body parts have, that will tell us where exactly we are in space. If we're standing on a firm ground, or if we're standing on sandy environment, or if we're standing on a pillow or a bed. Basically, this system will give us feedback on how wide our feet are placed, is our center of gravity within our base of support, and are we steady or not? So breakdown in any of these systems will change how your balance is, and how you perceive balance, and how balanced you feel. So coming down to talking about dizziness, since that's the main topic of discussion today, we're going to talk about the two types of dizziness by origin. I'm only talking about this classification because I want to get the central dizziness out of the way before we discuss the actual symptoms that bring people and tell people to go seek help. So the two types of dizziness could be either central or peripheral. When you talk of central, it's basically something that comes from the central nervous system, like the brain or the brainstem or the cerebellum, like we discussed, or it could be from one of the peripheral systems. The peripheral systems include the inner ear, the neck, the vestibular nerve, and any organ that's outside of the brain that produces the dizziness sensation. And both of these dizzinesses present very differently, and have kind of different treatments, and the symptoms are kind of different too. So just talking about the central dizziness, and since we're discussing dizziness after brain injury, brain injury can always cause localized injury to the brainstem. And like we learned earlier, the brainstem is one of the organs that processes the information that all the three sensory systems give it to give us better balance. So dizziness originating in the brainstem is usually comes along with feeling, having a headache, feeling unsteady, feeling like you're going to fall, the feeling of vomiting, nausea, not being able to see clearly, having weakness in specific parts of your body. And sometimes it has, you can have a localized loss of sensation or numbness. With dizziness that is central coming from the brainstem injury, hearing usually stays intact. The hearing is usually affected when it comes to peripheral dizziness, especially if it's traumatic. So traumatic brain injury to the brainstem itself, the hearing will usually stay intact, but you can have all these other symptoms. When dizziness originates from the cerebellum, you feel uncoordinated, your body parts, there's a lack of tone. Again, you feel unsteady. Sometimes there's involuntary eye movement that changes with body position. Your hands and legs have tremor with movement. When you're trying to move and grab something, you're going to feel tremulous because there's a lack of control there. You can't aim at targets. You might miss. Call it dysmetria. And there's also a lack of tone in the trunk. There's weakness in the trunk. So you're going to feel kind of wobbly when you walk. So a central dizziness is basically a feeling of imbalance that comes from cerebellar or brainstem injury. So now that we have the central causes of dizziness out of the way, we're going to discuss the three types of dizziness by the symptoms that originate in one of the two, central or peripheral. But we're going to focus, we're going to do a focused discussion about the peripheral types of dizziness. So when you go to the doctor and you tell them, I'm woozy, I'm dizzy, they're not going to know exactly what you're talking about until you can explain better how you're feeling. So they're going to follow up with, so when you feel woozy, is it like everything around you is spinning? Or do you feel lightheaded and faint? Or do you feel like you're going to fall? So describing the wooziness and dizziness, we can call it vertigo when a person feels like things around themselves are swaying or spinning or moving around. Or it could be pre-syncope, like you feel lightheaded, almost like you're going to black out, or you feel like you're going to faint. And loss of equilibrium or instability. That's going to come from disequilibrium or lack of balance, where you feel like you're going to fall. So how do people usually describe pre-syncope or the lack of the dizziness or lightheadedness? I felt like I was going to pass out, people say. Sometimes I have clients who say, I feel so lightheaded. I have black spots in my vision. I can't see clearly. When I stand up or sit down or change my position too quickly, I feel like I'm going to pass out, faint. And the main reasons for pre-syncope after brain injury could be medications, postural hypotension, and something called postural orthostatic tachycardia syndrome, more commonly known as POTS, even though it's a really rare condition. But I just wanted to bring it out there because it is usually caused as a chronic complication of brain injury. So medications like antidepressants, anti-seizure drugs, drugs that control high blood pressure that make you use the bathroom a lot, they could cause dehydration, sedatives, tranquilizers, narcotics, all these, and these are so commonly used after brain injury. All of these medications can cause you to feel lightheaded or faint or not so great. People with brain injury also have postural hypotension. If you're not drinking water enough, or initially when there's, you're spending a lot of time in bed, there are huge fluid shifts in your body. The medications you're getting can lead to dehydration. And that's when you can end up feeling the same thing, lightheaded, dizzy, especially when you first stand up. People in the hospital often have syncopal episodes, meaning they pass out when they first stand up, after a while. And that's very, very common. Rarely, I've had clients who had concussion or mild brain injury of sorts. And then a couple months or years later, they develop something we call POTS, or postural orthostatic tachycardia syndrome, which basically causes a change in the blood pressure and heart rate when you change positions. And this becomes so chronic over time that this gives you the feeling of pre-syncope. So we described the first type of symptom, the pre-syncope. Now we're going to talk about disequilibrium, or the feeling of being unsteady or imbalanced. And that's what people usually tell me. I feel so imbalanced. I feel like someone was pushing me, you know? I can't stay up. When I try to lift something heavy from the floor, I feel like I'm going to fall backwards. Or when I try to lift my child off the floor, I can't grab my balance when I first stand up. And these people also tell me that they have difficulty walking in the dark. And this is basically, again, this puts you at a risk for falling, and just like every other dizziness would, but you feel imbalanced when you walk. So what causes this disequilibrium, or this dizziness that causes you to feel imbalanced? It could be caused by one of the two central causes we talked about earlier, an injury to the brainstem or an injury to the cerebellum, because those are the two main processors of inputs from our sensory system. Or it could be one of the peripheral injuries, which could include BPPV. We'll talk a little bit about it. Labyrinthine concussion, a perilymphatic fistula, or a temporal bone fracture. All of these injuries can result from a brain injury. So they're like a secondary complication of a brain injury, or they could occur during the direct assault that caused the brain injury itself. So the feeling of imbalance and unsteadiness can be caused by any of those causes. And all those peripheral reasons will also cause you to have vertigo. And vertigo is basically the sensation that your environment is spinning around you, that you can't hold your balance steady, you feel nauseous. And this vertigo, it can be caused by labyrinthine concussions, BPPV, perilymph fistula, temporal bone fractures, or neck injury that you could get during your brain injury episode, or the assault that caused the brain injury. So let's just talk about one of these things at a time. I'm not going to discuss temporal bone fractures. They result in one of these four other things, or one of these three, the top three. They require surgery, and they require lots of diagnostic procedures to find out if that really is the cause for your vertigo. And after a brain injury, usually a diagnostic procedure will rule out temporal bone fractures. So how do people describe BPPV, or as we call it, benign paroxysmal positional vertigo? They say that, oh, I woke up and everything was spinning around me, or I tried to roll around in bed and everything started moving, or every time I try to get up, I feel like I have to fall back. These symptoms are very classic of BPPV, and what's the most classic is that they only last a couple seconds or maybe a minute, and they go away. But these people usually have a subtle level of disequilibrium that keeps them feeling imbalanced through the day, and these episodes really throw them off. So they get afraid of doing things like these that make them feel like that. This is one of the most common causes of dizziness after brain injury. And it occurs, we talked a little bit about the vestibular system, or the system in the inner ear that had those three hoop-like structures. Those hoop-like structures and that utricle on the bottom, the utricle on the bottom contains small calcium carbonate crystals that are called canalets. And those canalets can get displaced and move into one of those canals. And when it goes in the canals, it changes the way the fluid moves and sends wrong information, wrong signals to your brain, telling it that something is moving. It causes your brain to feel like something's moving while nothing might be moving. So everything, it gives you the sensation or the delusion or the illusion that things around you are spinning. So it occurs when the otoconia are displaced from their home in the utricle and collect in one of the canals. Patients with this condition have bouts of vertigo that last less than 1 minute, and are usually very commonly associated with specific head movements or changes in position. So if you get vertigo with one particular movement, then you'll have it almost every time. We'll talk a little bit towards the end about how BPPV is treated, since this is so important. And people suffer with BPPV for years and years before they come seek help, because they just learn to limit what the offending movement is. I had a patient once, she had to get to ShopRite, and every time she would make a left turn, she would get dizzy. So I'm not kidding, this woman had decided that she was going to take the longer route, which only involved taking right turns. And she did this for years before she came to me for something else. And she told me about her situation, and we fixed that. And the next time she went to ShopRite, it took her less than 5 minutes to get there. Meanwhile, she'd been driving 3 or 4 miles extra for years. So she called me back and she told me how great that did. So, it's an easy-ish problem to fix, but people suffer with it, and they create avoidance behaviors around it that they don't have to do it. They don't have to feel dizzy every time they do those things. So moving on to labyrinthine concussion. Labyrinthine concussion, when people have this kind of injury, they have a huge assault to the labyrinth is basically the bony structure that contains your vestibular system. So if there's a concussion in there, they have a acute phase meaning a period of 3 or 4 days where they feel constantly spinning. And after the worst of it is over, they end up feeling really off balance and really sick. And, they can't really have a lot of visual stimuli or a lot of movement around them. And this is quite a severe injury, and this itself can also cause BPPV. So it's basically a metabolic deterioration and cell death after violent movement of fluids. There are fluids in there that move violently, and they kill. There's cell death associated with that violent movement. Sometimes a temporal bone fracture can cause a concussion within the labyrinth, and it also comes from head trauma or whiplash, similar to another, a regular concussion or an MTBI. Again, the treatment for labyrinthine concussion, which is also called labyrinthitis, is more long-term, and we'll talk about the treatment of the dizziness resulting from the labyrinthine concussion towards the end of our presentation. So when moving on to the next cause of vertigo and disequilibrium after brain injury, sometimes people get a fistula. A fistula basically is an abnormal communication between 2 parts of the body or 2 canals. So perilymphic fistula basically is aberrant communication between 2 parts of the ear. So people who have this kind of fistula they tell me, my ears feel so full, something's inside my ears, sometimes I can hear, sometimes I can't, I don't know what's going on. When I start to move, I feel so unsteady. Or this is very typical for them. They start to feel dizzy every time they blow their nose or have a big sneeze or laugh. That's because of the changes within the ear that causes movement of fluid or shifting of fluid between the middle ear and the inner ear. So if you look at this picture or the shot of the MRI here, you can see that there's leakage of fluid from the endolimb, which is leakage of fluid or the endolimb from the inner ear to the middle ear. The endolimb is basically the fluid that is in the inner ear that has shifted through the fistula or a tiny little hole into the middle ear. And it usually occurs as a result of trauma, such as temporal bone fracture. Sometimes it happens from just a violent movement. You may have a small one, since birth, but the trauma will exacerbate it or actually show it. And this might be, this and the temporal bone fractures are the only 2 things dizziness-wise that might require surgical treatment. Moving on to the last cause of vertigo is neck pain. Very often with a head injury, the neck is injured too. And, I've been in the hospital. I worked in the hospital for so long. We're always so focused on fixing everything that's wrong with the head. We never pay attention to the neck. The patient themselves don't realize sometimes that they've hurt their neck until much after, because, you're trying to fix priority number one, that is the brain injury, and the neck and the limbs and everything is kind of a secondary problem at that point. But people who have vertigo that comes from the neck issues don't have the involuntary eye movement that comes from vertigo from the inner ear issues or the brain issues. They usually tell me that the dizziness is worse in the mornings because from sleeping with a stiff neck all night. They often have heavy, severe headaches. The neck feels stiff, and the biggest complaint is when I look down or look to the side or look down, I start to get dizzy. And this dizziness could be transient, or it could, stay with you for a little bit. But people with neck issues usually end up having some sort of dizziness if it's left untreated for a long time. So we talked a lot about the causes of dizziness. I'm going to talk about what time, when should you go get help? I'm just going to give a little bit of a warning that please don't self-diagnose. I know I gave a lot of information. Please don't try to diagnose yourself. Please see a professional. Professionals are obviously well equipped to properly diagnose you and give you the correct information and direct you where you need to go. So go seek help. Go get help if the dizziness is severe or keeps coming back if it's recurrent. If it interferes with daily functioning, like my lady who drove to ShopRite for several miles rather than half a mile away, makes you feel like limiting daily tasks. Avoidance behaviors always cause problems in the future. We feel like, oh, I'm fixing the problem by not doing it, but that's not the solution. So if you feel like your dizziness is limiting your daily tasks, please go get help. Please get it treated. If it makes you fearful of falling, or if it makes you fall, that's a good time to go get help. If your dizziness changes your behavior, I have patients who feel irritable, angry, and anxious because dizziness is not pleasant. It makes you feel like wanting to curl up in bed and do nothing all day. It changes your behavior. So if you feel like that, please go get it treated. And often having a long-term issue and having a brain injury itself make you predisposed to feeling depressed or having depression. You don't want to let it go that far and try to get treatment before it starts to make you feel not so great. So you should go get help, but where? I know that after a brain injury, and especially when you have dizziness, there's a lack of vocabulary. You can't truly describe how you feel. You feel fuzzy, you feel dizzy, you feel woozy. You can't really tell the doctor exactly how you feel. And that I've found that a lot of my clients with dizziness are going from doctor to doctor to doctor because they can't really pinpoint the problem and they can't really find the right diagnosis. So, a good rule of thumb to follow is you should go to the primary care physician first. They're an amazing resource. They rule out the benign causes of dizziness, the not so crazy ones like dehydration or high blood pressure. They'll make sure that you don't have those things, and they may be able to tell you exactly where to go. The neurologist provides medical management for stabilization and, making sure that you're not having major issues from the central cause of dizziness, like a brainstem injury or a cerebellar injury. The cardiologist will rule out and treat the cardiac causes of dizziness, especially the postural hypotension or high blood pressure. They're, well adapted and well equipped to treat those conditions. ENTs and audiologists, especially those that treat clients who have vestibular issues or dizziness-related issues, will be very good at diagnosing because they have all the right equipment to properly diagnose you in ENG machine or whatever else might be needed to properly diagnose you. Vestibular specialized physical therapists like myself were very well equipped to diagnose peripheral dizziness as well as rule out central, and we treat all types of dizziness. Once you're medically stable, we can treat all the types of dizziness and improve your balance. Every PT, you could go to, the PT next door, and they could definitely help improve your balance, even though they may not be able to fix the dizziness. Every PT can fix balance. Neurooptometry and occupational therapy will help with vision, because there's a lot of visual changes, A, with brain injury, and B, also with inner ear deficits, because the inner ear communicates with your eyes and gives you better control to eye movement. A neurosurgeon might be required if or when you have a temporal bone fracture or a perilymphatic fistula that needs to be corrected. And psychology or psychiatry, if you're facing chronic dizziness or issues that have limited you for a long time, it might be great to get support from these professions and fight the fear avoidance and avoidance behaviors. So what is the treatment of dizziness? Obviously, the first thing that comes to mind is medication. Medications to suppress the dizziness. While medications are a useful tool, they don't really treat anything. They're only masking the symptoms. They're only making you feel okay in the moment. The true treatment for dizziness is VBRT, or vestibular and balance rehab therapy. This is the real treatment. With the medications, you can use them in the short term, make you feel good. But if you take them for too long, they can actually slow down the natural compensation processes and the effectiveness of BBRT. And surgery has its place, but it's very rare, and it rarely helps with treating dizziness unless there's a structural issue that's causing the dizziness. So BBRT is extremely helpful in promoting the recovery of function and balance. This is the more difficult, but the correct way of fixing the dizziness and imbalance issues you might be having. It uses your existing pathways in your brain. You don't need to create new ones. It uses existing pathways. It causes adaptation in those pathways. It uses the plasticity or the adaptability of your brain to make you be able to do things that you weren't able to do before. And it also gets your brain used to the different signals or the varying signals that it's getting from the visual systems and the vestibular systems that are now, kind of changed. So BBRT works best for people who have uncompensated and non-changing. It doesn't keep changing with, change in position or time of day. If you have a fixed kind of dizziness which is not compensated, that will improve with vestibular rehabilitation. Vestibular rehabilitation has several components. I'm just going to talk about the right bottom corner, the canalith repositioning maneuvers. They're helpful in treating BPPV, which basically brings those calcium carbonate crystals back into their home with a series of head movements. They're very scientific movements, and they basically use gravity to move little crystals out of the inner ear and bring them to where they belong. They need to be done in the right way. Obviously, there are lots of people who feel like they could view a video on YouTube and go for it. And if that helps you, wonderful. But I suggest highly that you do see a professional when you're undergoing any of these maneuvers, because A, they're not pleasant, and B, you want to do it the right way so you don't have the problem coming back to you. And apart from the treatment of BPPV, treatment of balance and other dizziness, especially the one from the labyrinthitis or nerve damage, are habituation, adaptation, and adaptation and substitution. Now, habituation is basically provoking and using provoking stimuli and repeatedly doing the same activity to get your brain to relearn what signals it's going to get, how it's going to get the signals, what the new signals are, and get used to it. If it's getting conflicting signals from the left and the right vestibular system because one side is damaged, by doing those offending movements again and again, you're basically getting your brain used to that new kind of information. Adaptation is improving or getting your brain to be able to use newer pathways, plastic pathways, and bring long-term changes to the brain to improve your posture and to improve your balance. And substitution is basically using other systems and other strategies to compensate for a lack of gaze stability and posture control. So when you talk of substitution, you can think of, sometimes when you are really feeling dizzy, you can use a cane or you can use a walker, and it'll make you feel more balanced. And a therapist will treat you what the best kind of substitution would be. We can also train the other balance system, like if something's wrong with the vestibular system, we can train your brain to better use your visual system to help balance you, or better use your somatosensory or the body awareness system to better balance you. So those are the 3-4 mechanisms by which vestibular and balance rehab therapy work. And obviously, I have firsthand experience. I've helped hundreds of clients using these exact maneuvers to help them get better and get stronger and get back on their feet. One thing that nobody can replace, no professional can replace, is family support. People who have dizziness are already dealing with a lot to begin with. It's very hard, it's very anxiety provoking, and it's very difficult to deal with these symptoms on a day-to-day basis. Family need to understand and support the process of rehabilitation. It takes time. The Canalith repositioning maneuvers might be quick, but the other 3 take time. It can take several weeks, maybe months, depending on how long you had your dizziness, and you need to stick to the home exercises. The family needs to support the home exercise program. And the physical therapist will show you what to change in your home to make you feel more sturdy and more steady in the home. And if there's anything that's out of place or dangerous, the PT will be able to suggest modifications to make your home safe for you. So I have a lot more information about balance and about dizziness and about how to feel steady, and some things that you can do to make yourself feel more balanced. Please go to my website, and there's a little pop-up. Please put your information in, and we'll send you a free guide called Becoming Rock Steady. It basically has a lot of information about balance and about 3 systems that I briefly talked about earlier, and how to improve the balance. You can also contact me at my email or my phone number. Feel free to call me and talk to me if you need any help, or even if you just need direction as to where you need to go with your dizziness and who you need to contact. And I just want to thank you very, very much for attending. Call us at 609-726-6003. We help lots of clients with dizziness get back on their feet and go back to doing things they love. So if you have been dealing with this problem for a long time, please put your trust in us, and we'll be able to help you get back to being strong and steady and balanced. Thank you. And I'll open the forum for questions.
Beautiful. Thank you, Dr. Shah. So just a reminder to everyone in the audience, if you have any questions, please send them in now. And I have 3 questions, or actually 4 questions that we can begin with. So I will keep an eye open for new questions coming in. The first one, do you have any clients with, and forgive me if I mispronounce this, Meniere's, MENIERES?
So Meniere's disease, it is a chronic vestibular issue. There are a lot of compensations that people with Meniere's go through. There is some place for vestibular rehabilitation in Meniere's, but not a lot. It's a hard to treat chronic disease, and most of it is medical management in the case of Meniere's disease.
Okay, thank you. The second, how long vestibular and, balance rehab, how long does vestibular and balance rehab take?
It can take anywhere between 6 to 10 weeks, depending on how good you are with your home exercises. If it is just BPPV, it can be treated in 2 to 3 sessions. But if it is another peripheral problem apart from BPPV, it can take anywhere between 6 to 8 weeks for you to see real improvement.
Nice, thank you. Okay, our next question, and this is a little bit long. How does TBI affect your muscle and whatever controls the balance in your head memory? This is from someone that was hit by a car and sustained a brain injury and has dizziness from that. And so she asks also, if we learn to correct it, how do we keep that knowledge within us?
So I think it's a two-part question.
If you like.
Can you tell me the first part of it?
Sure, I'm sorry, I had interrupted. How does TBI affect your muscle? I'm assuming the brain muscle, and whatever controls balance in your head memory.
So TBI can affect different parts of the balance system. We talked about the sensory input, the central processing, and the motor output. Brain injury can affect all three of these. If you talk specifically about muscles, if you have a damage to a certain part of the brain, it can directly damage that control to that part of the those muscles that the brain was controlling, that part of the brain was controlling, and that can cause you to have weaknesses. And if you're talking about the processing itself, it depends on where the injury is, that how it's going to affect your ability to balance yourself. And the second part of the question was something about memory.
Yes, the second part was that if they work on that, they come and they get the help and it begins to get corrected, how do they keep that knowledge with us? I guess memory.
It's more, it does not involve the memory. The goal of vestibular imbalance rehab therapy is to improve at a subconscious level, meaning you don't have to keep thinking about it. There are phases of learning. The first phase of learning, you have to think about what you're doing. The second phase of learning, you can probably do it, but it's kind of hard to do in difficult environments. And the third phase of learning is automaticity. It makes it automatic and easy to do. And with BPRT, we want you to have balance at an automatic level. We hope you don't have to think about balancing yourself by that point.
Okay, thank you. And then the last question that I have, and like I said to everyone else, you can write in if you like. One question that's been coming to me is, will this be available? And yes, within the week, this PowerPoint, this great webinar will be able to be seen on bianj.org/webinars, along with Dr. Shaw's references, other things that you'd like to attach, and the link to her site. So if you have any questions, and I also put my email in there. So if you'd like to, if you come up with any questions after, you can send them to me and I will send them to her. The one last question that I have is, one person wasn't sure if they needed to go for help. They had sustained a brain injury. Occasionally, every once in a while, they'll be speaking to someone and they get a little dizzy. What their concern is, they feel like an electric shock or electric wire at the same exact time. It lasts very briefly. Is this something that they should be concerned about?
I would go to a physical therapist and get the neck checked out. Usually, if it's a neck issue, it could be some sort of nerve impingement, and standing and moving and talking might be causing an aggravation to that.
Okay. And I know that we began very quickly this morning, so I don't see any. Oh, wait, 1 second. Okay, so a new question that came in from Jean Ingalls. After a concussion, can that make you more susceptible to other types? And
brain concussion, if you're talking about vestibular injury or dizziness, a concussion is a huge cause for vestibular injury. In fact, most of the problem that comes from a concussion is coming from the vestibular injury to begin with, because that structure is so close to the bone in the bony labyrinth that it's very, very easy for it to get injured. So yes, absolutely, concussion is completely related to vestibular injury and dizziness that comes from it. And the treatment is pretty similar too for concussion and vestibular injuries.
Right, and we have a lot of information on our website about concussions. And our concussions, if you receive a concussion, yes, then you're more susceptible to receiving more concussions once you have sustained one, especially if you don't let it heal fully before going back to routine. So let me just double check. I think that's all the questions that came in for now. I'll give it one more minute to see if anyone else, but with that being said, I also want to thank you, Dr. Shah. I know how busy you are for taking time out of your schedule. This is a topic, I know I worked throughout the state of New Jersey with going out to do exhibits and things like that before COVID, and hopefully soon again. And people come up to me all the time and tell me that dizziness is a very big challenge after sustaining a brain injury. So that's why we're so happy that you were able to come and speak on this topic today. We will be listing your contact information for your organization and also yourself. People will be coming up with questions after that. I can reach out to you. And again, for everyone in the audience, we will be posting this within the week on our website, bianj.org/webinars for you to watch, along with many other wonderful webinars that we provide in our archive that you can watch at any time. So I guess that's it. And I know we're ending a little early today. Oh, wait, I do see a few more questions. They're coming in right under the wire. So let me get them in before we end. So one person wrote in and says, I was hit by a car and had a TBI. Whenever I go to a store, it seems the lights make me very lightheaded and nauseous. Is this normal?
I'm sorry to hear that. And well, light sensitivity is a part of brain injury and concussion. That might be something you might be experiencing, but also going in the store when there's a lot of visual input, especially when you're in the aisles. If you're having issues managing that sort of visual input that points to a vestibular injury or an injury to your vestibular system that can be treated. So yes, please seek help. It can be fixed. Please go to a physical therapist. And to all the attendees, please go to my website and please download that document because it's a great tool to help people improve their balance and learn all about it and how to not feel challenged with dizziness and balance all the time.
We have another question that asked if you give consultations virtually. We do have a few people on the webinar today that are not in New Jersey. So they wanted to know if they can reach out to you in regards to a consultation virtually.
So within New Jersey, I'm licensed with the state of New Jersey, so I can provide virtual consultations within New Jersey. If you want to call me anyway, I'll be able to, I can just talk to you, and I'm a part of a lot of organizations that have a listing of vestibular therapists, and I can direct you as to where to go in your state. So feel free to call me or email me. My contact information is in the presentation. I'll be happy to help. You're on mute, Laura. I can't hear you.
See, that my children would be happy if I was on mute, but thank you so much, Dr. Shah, and for everyone today for coming out to listen. Again, I posted in the chat a few upcoming items that are coming for the Brain Injury Alliance in regards to the annual seminar and the Family Fest. We will be having upcoming webinars also, so just keep sight on our website. And Dr. Shah, thank you so much.
You're very welcome.
Thank you. And at this time, this brings us to the conclusion of our webinar. Have a wonderful day, everyone. Enjoy the nice weather.